Thanks, Jason. For board members that are on, if you don't mind just starting your video, if you haven't already, it just helps bring you to the front of my screen to get a quick poll of who is here. All right, I think just a quick look tells me we're pretty close to a quorum. I'm going to get us started. Good morning, everybody. Today is March 3rd, 2021. It's now 9:32, and I call to order this meeting of the Maine Emergency Medical Services Board. My name is Joe Keller. I'm the chair of the board. This meeting is being recorded. Before we go any further, I'd like to explain the circumstances under which we are holding this meeting and set up some ground rules for how we will be conducting the business of the meeting. Before I do that, please place yourself on mute if you have that capability. As you all know, earlier last year, I suppose at this point, the governor proclaimed a state of civil emergency in Maine as a result of the substantial threat posed by the novel coronavirus disease referred to as COVID-19. The governor approved emergency legislation that enacted Public Law 2020, Chapter 617, which, among other things, authorized state agencies to conduct public meetings through telephonic or electronic means during the state of emergency. As authorized by Title I, Section 403A1 of the Maine Revised Statutes, we're conducting this board meeting through video conferencing technology. The board posted notices of this meeting on its website and the legislative calendar. It is the board's sincere hope that all those interested in the subject matter of today's meeting have received notice of the meeting and how to participate electronically. The mission of Maine EMS is to promote and provide for a comprehensive and effective emergency medical services system to ensure optimum patient care with standards for all providers. All members of this board should strive to promote the core values of excellence, support, collaboration, and integrity. In serving on this board, we commit to serve the respective providers, communities, and residents of the jurisdictions that we represent. I'll need to ensure that we have a quorum, so I'll be calling rolls of the members that are participating remotely. When I call your name, please indicate if you're present. Dr. Zimmerman.
Present.
Dr. Cole.
Present. Present.
Nate.
Present.
Tim.
Present.
Carolyn is not here. Brad.
Present.
Joe Conley.
Present.
Heidi.
Here.
Laura.
Here.
Amy.
Here.
Judy.
Here.
Rich.
Present.
Brent. Indicated that he would probably not be present. Dr. Martell.
Present.
Julie.
Present.
Dennis.
Present.
Steve.
Present.
And Scott.
Present.
All right, I count 15 members present. We do have a quorum. Quorum is 9. Before turning to the actual agenda, I'd like to go over some ground rules for how this meeting will be conducted. I've already asked that everyone place themselves on mute when not speaking. Anyone from the public should place themselves on mute unless providing public comment. In order to minimize members talking over each other, when you'd like to speak, simply state your name and wait until I call on you to speak. If we vote on any issues, I'll conduct a roll call vote as required by law. At this time, if any board member has a question, please state your name and I'll call on you. Hearing none. Turning to the agenda. First item is disclosure of any conflicts of interest. Is there any member of the board that has a conflict of interest with anything that is on today's agenda or with your role as a board member? Hearing none, we will take up a Life Flight of Maine ground scope request. We should have done it in the last meeting. We'll talk more about it when we get there. I will be presenting that and will be recusing myself. Is a administrative point for today's meeting. Brent is unable to join us due to a conflict in his town. And unfortunately, I have to be out of this meeting by 11. Chief Soucy's graciously agreed as the past chair to step in to chair both the piece that I need to recuse for and if this meeting goes beyond 11. So that will be the plan for today. And thanks to Chief Soucy. Any modifications to the agenda that anybody wishes to make? Hearing none. Minutes from the February 2021 meeting were circulated by Director Hurley. At this point, I would entertain a motion on the February 21st minutes.
Dennis.
Dennis, motion to approve. I assume?
Motion to approve.
And that was Tim with a second.
Yes.
Thank you. Any further discussion?
Chair Kellner.
Dr. Zimmerman, go ahead.
Just one thing, there was a duplicate sentence under the section of the Trauma Advisory Committee update. That's all.
I would ask the office to make that change, and Dennis and Tim, if you're okay with the edits, I assume.
Yes, sir.
Getting nods and yeses. Okay. Any further discussion? Hearing none. Nate.
Yes.
Tim.
Yes.
Brad.
Yes.
Joe Conley.
Yes.
Heidi.
Yes.
Laura.
Yeah.
Amy.
Yes.
Judy.
Yes.
I vote yes. Rich.
Yes, sir.
Dr. Martell.
Yes.
Julie. Julie, you may be on mute.
Yeah.
I got Julie's yes. Dennis,
Yes.
Steve,
Yes.
and Scott.
Yes.
Unanimous of those that are here. Thank you very much. Moving on to the director's report. Sam.
Good morning, everyone. Oh, did you want to take public comment first, Joe?
You know, I was just thinking, did I do that or did I not? And I convinced myself I did. Sorry about that. Yeah, we will take public comment at this time. If there's any member of the public that wishes to make comment, please indicate so now. And I see Rick Petrie has his hand up. Rick, go ahead.
Thank you, Chairman Kellner. I just wanted to take a minute and acknowledge the passing of Dr. Paul Lebo on February 1st. Many of you remember Paul. He was an active member of the EMS community and the Northeast Region Council for many years. He was a major proponent for EMS services, very active in the community with both the MDPB and the board, as well as service director for a number of services. He also served as the poet laureate for the state of Maine and for a number of years, and worked closely with Life Flight and other programs in the area. So his loss will be greatly felt by the community. He certainly had a big impact on EMS.
Rick, thanks for that. And I would actually like to ask the board if we could take a moment of silence in remembrance of Dr. Lebo. I think that would be appropriate. Okay, thank you very much. I have a phone that I didn't know was in my office. I'm not sure whose it is, but it's going off. Give me just 1 second. All All right, it's not ticking, so I think that I'm okay. Is there any other member of the public that wishes to make comment? Hearing none, sorry for missing public comment again. Moving on to the director's report, Sam.
Try this again. Good morning, everyone. I hope everyone's doing well. Please do accept my apologies for the tardiness on getting the materials out. I was unexpectedly out of the office this past Monday, so I apologize for that. As far as the legislative update, there aren't any major updates at this time compared to last month. The bills are still being put out as LDs. We know that there are LRs that affect us that are in the hopper, but we haven't heard any more about them. I know that there is a PTSD bill that will affect dispatchers, and I have expressed my support of that to the commissioner and to Brody. I believe Brody will be the one testifying for that in regards to that bill for the Department of Public Safety. But I have expressed my support of such a bill. I'm not exactly sure what the governor's office will do. I know that there's a mandatory report that comes out or that is associated with that original language. So I'm not sure what the governor's office plan will be regarding that bill, but just letting you know, my original intention is to support that, to protect our dispatchers and to help support our dispatchers and EMD professionals throughout the state. So as far as other legislative updates, I don't have anything major this go round. Regarding vaccinations, which I know is a hot topic on everyone's plate, Maine EMS did open up vaccinations to other vaccinating organizations. I know some of you on this call opted to join in the fun, if you can call it fun, or misery, whichever one you want to call it. And for that, we are immensely grateful. Right now, EMS agencies and organizations are finishing up 1A public safety vaccinations, the second doses primarily, and then there are some agencies who are embarking on vaccinating senior living residents and independent living residents, as well as shut-ins. And then they are also soon to embark this next week on vaccinating teachers in some areas. That's going to be coordinated through Maine CDC. The teacher is a Maine CDC DOE thing. And so not all agencies will be doing that. They're going to mainly try and use the mass vaccination sites and then offset that with EMS and other entities to help support those sites where they have holes. Because they know they're going to have some holes in 3 or 4 counties. And so they want to make sure that they offset that with that kind of support. Additionally, Maine CDC has opened the floodgates to allow EMS to vaccinate the general public, should they wish to do so. And so that door has been opened as well. The method by which people can do that is they have to submit a plan to us of what they're going to do, where they're going to do it, how many they're going to do. So that way Maine CDC has some kind of situational awareness of what's going on in the community. And then they review that and approve it. So usually it's been approved within 12 hours. So really quickly, so the agencies can start planning on that. They just really need to know where the locations are because they're mapping them on a map, because their goal is to make sure that everybody in the state has some kind of location within 30 minutes of their residence. So that's really their modus operandi, is to make sure that they can map it to accommodate that 30-minute window. I know that there are rising frustrations, concerns. People may be throwing things at the wall regarding reimbursement. I tell you that is not unfounded, and it's not something we are expressing the same frustration towards the Bureau of Insurance. So Maine EMS has been working with the Bureau of Insurance since early December on figuring out a mechanism by which EMS can directly roster bill insurance agencies. We did our part. We developed the form, we developed the tool. Literally, it's automated. the system automatically spits out everything that they've asked us to produce for them. We are waiting on the insurance companies to figure out a way of how they want to receive the information. That's what we are waiting on. I know that there are 4 agencies working on a pilot to test reimbursements with Harvard Pilgrim. And I know there are some other agencies that said that they would have their tool up by mid-March. So I assume that's next week or the immediately following. So that's where we are. I sent an email over to the commissioner, or I guess they're not a commissioner, the superintendent of insurance yesterday, expressing my concern. We ran a report and there's about $315,000 worth of vaccination administration fees on the books right now that have gone unpaid. And I expressed my concerns to them that in a system where we're already teetering on, financial instability, this does not work for us. And they need to put pressure, however they have to put pressure on these organizations to figure it out. And I've also raised this to the commissioner again to push it up to the gubernatorial level to say, this has to be figured out. You need to figure it out. You've had 4 months to figure it out. It's time. So that is where that is. I'm sorry I don't have a firm update that, by Friday at 5, it's magically going to work. I wish I had that, but I don't. But I will tell you that Maine EMS, Darren in particular, and Jason have literally done everything that these insurance companies have asked us to do in developing the tools, the exports, the forms. We're waiting on them. And so I don't have any authority over insurance, so it's kind of out of my bailiwick. But I have expressed concern about them moving forward with that. So just wanted to put that update out there. I know that people have concerns. I hear it. I hear from the regional administrators that there are some that some agencies that are opting not to participate in vaccination efforts because of reimbursement. I hear that. And we are working to pressure them to get that resolved as quickly as possible. So that's kind of my update there. And then it looks like Joe wants to make a couple of points about billing before we move on to the individual reports from my team.
Yeah, just some points for the group here and for any EMS administrators that might be on the call if it's helpful. We have had some success in billing, and I've shared our process with some other entities as well so far. I will say that EMS isn't alone. Several of the big carriers are still building these codes in their system and haven't started cutting checks yet. Some have. It's quite a process. Medicare is particularly challenging for roster billing. You have to have their specific program to develop the roster bill, unless you have a third-party intermediary that'll do it for you. But I would say that EMS isn't alone. That's kind of the important piece here. The other piece to remember is for folks that are looking to get into the mass vaccination business long-term, I certainly don't want to dissuade anybody from doing that, but the commercial carriers have only agreed conceptually to allowing roster bills for a short period of time to get through the COVID crisis. So if you are thinking about doing this long-term, I'd recommend you set up a more a long-term sustainable process that allows you to submit individual claims. And just a personal offer outside of my role on the board, if anybody does want some help and assistance, I'm happy to share some lessons learned that we had in building our system as well. Thank you, Sam.
Thank you. And one last thing before I move on to the team reports. I believe I alerted the board many months ago that Maine EMS had been awarded the Maine Stroke Alliance support funding from the Rural Health Program. We did notify the Maine Stroke Alliance of that because apparently Maine CDC did not. So we did inform them of that. Dr. Zimmerman has been working closely with them and Dr. Scholl have been working very closely with them. Dr. Zimmerman will be assisting in being and will function as the program manager for that, much like she does for the TAC. But I did want to let you know that we have been working on that. And we are working through negotiations with the Rural Health Alliance for our upcoming grant year, which hopefully will include another $5,000 for support. So I am trying to grab more money from them, and I will talk later about another $50,000 grant that I received just 2 weeks ago. That's what I'm asking for, some spending authorization. But I received another $50,000 grant. So we're trying to bring in more funds that we can do more for the state of Maine and do more for our EMS clinicians throughout the state. But my model here is a system of care model for time-sensitive conditions. So really bringing up trauma, bringing up stroke, bringing up cardiac arrest, bringing up STEMI, bringing up sepsis, these systems of care to make sure that we are meeting national benchmarks and that we can improve the quality of our care throughout the state of Maine. So that's my vision, is this systems of care model. But focusing on the Stroke Alliance is just one next step in that process. And we're happy to support them in ongoing support. So I will turn it over to my team. I will start with Mark.
Good morning. So the EMSC Advisory Committee has not met since our last board meeting. Some general updates around the EMSC program is that we continue in the final 2 weeks of our EMS survey around pediatric training. We've had a pretty good response. 78% of the services in Maine so far have replied. I've got about 58 services that I haven't heard from yet. I've reached out to a lot of different members of their contact team, but still waiting, and hopefully in these last 2 weeks, people will finish those up. So good in that sense. I've been working a lot with DHHS. They're finalizing some programs on neonatal and maternal recognition of levels of care. So if you think conceptually, kind of like the ACS levels of trauma services, Maine's going to be recognizing hospitals for their level of maternal and neonatal care, and starting inspections shortly with that. And so that's kind of exciting. Won't impact EMS too much because it's mostly around their in-care processes, but would help define some of those movement of patients from smaller hospitals to larger hospitals as needed. It's a little bit confusing because, you know, people in maternal and neonatal medicine do things a little bit different than trauma medicine. So a level 4 recognition is actually the highest, and level 1 is the lowest, as opposed to trauma, which is the other way around. So a little bit confusing that way, but it's the way they've kind of done things. I'm doing a presentation to the Maine Association of Certified Professional Midwives next week at their conference to try to introduce some understanding of EMS and work with them a little bit further. So that's an exciting connection between those two. So working closely with the midwives and their new licensure status since the past year, and a variety of different presentations that we're putting forward. I worked with Kelly Bowden and Dr. Jen Heyman from Maine Med on doing a safe sleep presentation. We're finalizing that to go on MEMS-Ed, and this is for EMS to recognize unsafe sleep situations in home when they go on EMS calls, and some options and resources for how to help families that may not have access to cribs, and preventing. Frighteningly, Maine has about 12 deaths annually that are attributable to unsafe sleep situations. So parents rolling over on children that co-sleep with them and things like that. So this is kind of some education for EMS providers to be aware of and looking out. I'm working with APEMS this Thursday to do a presentation on Brewy. So thanks to APEMS for supporting that. We're presenting at the Maine Med Pediatric Conference on Friday. So thanks to Maine Med for that. That's on safe pediatric patient handoffs. And we also help support Northern Lights Mercy Hospital's presentation on risky behaviors for teens. So they did a nice presentation over a couple different days and had a lot of statewide attendance. They were pretty excited because we promoted it, and with the Zoom platform that they did it, they had a lot of people outside their normal catchment area of Mercy Hospital in Portland, and we had folks from Caribou and Castine attend, and so it was a nice coverage and nice spread of information that way. And then Otherwise, our fiscal year ends the end of this month, 3/31. We're well on track to be under budget, but trying to maximize all the dollars that we have available to us. So we'll be spending the last few remaining dollars on some educational opportunities for pediatrics for everyone in the state. So working with Director Hurley on that. And that's what I have, unless there's any questions.
Thank you, Mark. Chris?
Thank you. Good morning, everybody. At this time, we're doing some work with the MEMS Ed website. We're looking at pursuing a new contract with the Muskie School for administration and site maintenance work. I've been working with the licensure folks on an EMS clinician reentry licensure pathway that aligns with updates to the National Registry's reentry certification pathway. It's something that I've recently brought to the Education Committee and asked that we take a look at. And the goal in doing this is to have a proposal outline along with supporting documents to bring to the board at a later time. We're very close to finishing that outline as well as our research. And as soon as we get done, we intend to bring it to the Education Committee again for a look. I'm also been working with the licensure folks on revising the CEH and licensure model to accommodate the January rules changes as we begin migrating to a 2-year licensure cycle, and also to the National Registry's NCCP model of continuing education hours, which is scheduled to be completed in 2024. So that's only 3 years away. We've discussed hosting training both on MEMS Ed for this and on Zoom regarding the changes in a sort of town hall. We're not exactly quite sure of the format, but that is our intention. And we'll certainly put more out to the regions as well as to yourselves as this progresses. Following Director Hurley's announcement regarding the allowance of EMS clinician participation for public vaccination efforts, Maine EMS has developed a MEMS Ed training program for the training of clinicians on the Johnson & Johnson vaccine. The training is live at this time on the website, and clinicians can go to the MEMS Ed LMS and take the training at their convenience. It's worth 1 hour of medical CEHs, and just like the previous vaccination courses, once that is completed, that will be reflected in each clinician's online training record. We're very grateful for the assistance in the development and especially the review of this training for everybody who participated in that, especially Doctors Scholl and Zimmerman. I'll be asking Mark Minkler's assistance in a little while in getting that announcement on our social media sites, and I'll also be putting this out to the regions via email. If anybody has any questions regarding the training, we ask that they be directed to myself or Director Hurley at Maine EMS. Regarding the Education Committee, I believe Brian Chamberlain is unable to attend the meeting, but I do believe Aiden Koplowski has a report. I think he is here today if you'd like to give the report for that committee.
Good morning, Chairman Kelder and the rest of the board. Thank you. The EMS Education Committee met last month. We continue with our training center standards update, and we got to the point here where we're discussing supervision as tasked with and IC licensure, and that conversation is going to continue again next week. AVOC, I've gotten to the point where I'll have a proposal for the Education Committee this next meeting. And hopefully the intention is to bring that forward to the board for your meeting next month. We're also continuing on working on protocol education as those drafts are posted on the website from the MDPB. And that's all I have for this one.
Thank you, Aiden. Regarding the exam committee did not meet last month due to, or this month, last month rather, due to the state office closure on the meeting date. The next meeting is scheduled for Tuesday, March 16th. and work is progressing on options for psychomotor skills exam testing for licensure. And that's all I have to report, unless anybody has any questions.
Thank you, Chris.
Just real
Jason-
quick, yeah, this is Joe. Just refresh my memory. Do we have any waivers expiring soon that we have to deal with related to education? I'm trying to think back to what we still have active.
I don't believe so. I think the last waiver that we had was for licensure. And I think that was extended, but that's it. I did have one question regarding IC licenses, if that was counted in that waiver, and I don't believe it was. I think it was just clinician licenses.
Just clinician licenses. Okay, thank you very much.
Sorry for cutting you off, Joe. Any additional questions? Okay, Jason?
Thank you, Sam. Chairman Keller. With the QI committee, we continue to work on the QI newsletters, and our next iteration of the QI newsletter is going to be the behavioral health newsletter, which will have a final version at the next committee meeting 2 Wednesdays from now, following the MDPB meeting. We've already laid out our pathway forward for the next year, essentially, with newsletter topics, and have assigned groups to assist in the development of those newsletters. So that's a good process moving forward, as we're going to start to take looks back at previous newsletters and do a comparative analysis to see if we've moved the needle any on those in those measures that we've already discovered. So the Community Paramedicine Committee has met, and the chair of that committee, Ellen McFarland, is here to report out on that.
So good morning. Let me see if I can get my video up here. So we did meet in the month of February. It was an abbreviated meeting, and we talked we really focused on the status of vaccines and the amount of vaccine that's been given by the EMS agencies who agreed to do that. I believe, Jason, it was we said 10,000 vaccines at that time, which I think is really pretty commendable. So this month, I'm sure that on our agenda, Jason and I will meet later this week to talk about our agenda. And I think the couple of items of interest are the posting of the positions. We have several open positions. I know they've been posted. I don't know what activity we've had. I suspect I will know later this week. And after this meeting last month, Rick Petrie kindly reached out to me. I know it's been a goal of Jason's to get some education posted on the education platform. So Rick kindly touched base with me. Sally Taylor is my point of contact, and we are going to work to have regular education set up on that platform. We'll have our own spot. And I believe the education for March is already set up. Sally Taylor had a program she wanted to post out there, but we will be in April, we will be posting some education on Alzheimer's. So we've got a few things going on. I suspect our meeting next Thursday will be a little bit more involved, and I'll have more update for you at that time. Hoping Jason might be able to just give a little bit of follow-up on the protocols. I'm not sure where we are with those, and I suspect he probably knows exactly where we are.
We are working on a guideline more so than a protocol for CP agencies to follow, and that guideline is largely in its complete status, and we've handed it off to the medical direction and practice boards for them to find a home for it on their agenda.
Hey, Jason, for you and for Ellen, just a thought I had with the LD 2105 work. One of the recommendations we brought forth to the legislature again was consideration of reimbursement for community paramedicine. So I wanted to make sure that you and Ellen and the committee were aware of that there will probably be an opportunity coming up as that bill progresses to provide some testimony and feedback on what reimbursement for community paramedicine services might look like. Thank you.
Thank you.
Joe.
Anything else, Jason?
No, Sam.
Do you have an update that you can share for data committee? Because I know Darren is unavailable today.
Absolutely. So the data committee did meet last month, and we had a large conversation about the RFP process and how we wanted to move forward with that. We've really begun collecting all the information for what our system currently has and what it offers, and what the different modules we have with it are, so we can put that together to be sent out for agencies to bid on. And we've discussed having a few open question and answer sessions that we want to send out a few questions to service leadership to determine what their ask would be for the system. And we've scheduled those to be hosted in some webinars that I believe are going to be at the end of this month, because we wanted to give people enough time. One's going to be a daytime session during the week, and the other one's going to be an evening session on a Saturday that will hold it. So people will be able to, hopefully people will be able to find time to attend one of those sessions. So, and that was the data committee meeting last time, all of it. Thank you.
Okay. Jess, do you have any updates?
I don't. Thank you.
Okay. Melissa, do you have any updates?
Yes, thank you, Sam. So the EMD committee has not met since our last board meeting. Our next regularly scheduled meeting is on April 15th. Today, we are publishing and pushing out an update to the guidance for the use of the COVID-19 screening tool. This update was only prompted by the recent release of an updated version of the software. So the changes address the updates to the software, but there is no change to the screening tool questions, the caller instructions, or the definitions that we're currently using for U21 advice. Also, I have an upcoming meeting with representatives from Saddleback Ski Patrol and their regional communication center about EMD protocols. This is a topic that the EMD committee had spoken about at their last meeting. We've created a subgroup to continue this discussion, but basically what we're looking to do is identify best practice for processing medical calls received from Ski Patrol and other trained emergency personnel. There's some frustration about the way that those are being handled now, with instructions that are maybe intended for lay persons, and we're just looking to overcome that frustration.
Thank you, Melissa. Any questions? Okay, Griffin?
Yes, good morning. As you all know, I serve as staff to LD 2105 and the Labor Committee. With that said, if I could turn it over to Joe Kellner for any updates on the LD 2105.
Yeah, thanks, Griffin. Just real briefly adding to what I said before, I think it was between the last board meeting and this one, I did a presentation for the legislature on the LD 2105 work to the committee that handles insurance matters. They were incredibly receptive to the work done by the committee and have already drafted some bill language that would significantly impact, I believe, positively reimbursement for ambulance services and a number of other things. That committee's taken a huge interest in how this might look. On top of reimbursement, there are some other things in that bill. It does require right now Maine EMS to look at a pathway for either certificate of need or community self-determination and develop rule related to that. And it does create an additional work group that looks at other reimbursement issues. The other big piece is cost reporting. Right now in the draft legislation, it will require all EMS services that wish to obtain the higher reimbursement rates to submit cost reports similar to that which Medicare is doing. Right now in the draft bill language, Maine EMS is the arbiter of that. I've pushed back a bit on that, saying Maine EMS may not be the best department in the government for that to land, certainly not without additional resources. Still very much draft. We've had some really great discussion. The big takeaway is the committee seems incredibly engaged, very supportive of EMS. And I hope that everybody will follow if you take an interest in this and take the opportunity when the bill does get presented to testify in favor or to add your comments related to the bill. Thank you.
Thank you. And if I may turn it over to Steve Smith for updates from the Labor Committee.
All right. Thank you, Griffin. Yeah, so Labor Committee meeting was actually a fairly short one, but it was a very good one. Aiden, Kowalski, Sam, and Griffin did a bunch of work on our focus group sort of proposal to the college. So they put it all together and what we're going to be looking for. And we're going to send it off to the University of Maine systems to hopefully be able to get this project rolling and get vetted good information. They're going to set up the focus groups. They're going to do a bunch of the work and then get it back to us. So as many of you may have seen, we have canceled this meeting this week because right now we're waiting for it to all get approved and then sent off. So we're sort of at a standstill right now, at least for the time being. We will go on a week-to-week basis, or sorry, bi-weekly basis, to figure out whether or not we need to meet and discuss anything, any changes, and then we will go forward from there. That's where we're at. Progress.
Thank you, Steve. That's all I have right now, unless anybody has any questions.
Thank you, Griffin. Chairman Kellner, that is the end of my report at this time.
Very good. Thanks so much. Any questions from any member of the board for the Maine EMS staff? As has been the case all along, some really great and impressive work going on. So huge thanks to the whole team at Maine EMS for that, all the efforts being put in. We will move on to the medical director's report. Dr. Scholl, I understand you will be passing this off to Dr. Zimmerman for today's report. So we'll give it to Dr. Zimmerman.
Yep. Good morning. And so the MDPB continues to work on our protocol updates. It's kind of our all-consuming objective at this point. The updates, the new protocols are scheduled to come out December 1st of this year. So this past month, we worked on final edits for the yellow section, and that change document will be posted soon. The green section has been completed, and we've started to go through the protocols and look at the pediatric protocols. Sorry, I have a child in the background, homeschooling. Apparently it's fun. We've been working closely with EMSC and Mark regarding the pediatric updates, and we will be working closely with the Education Committee in using any of the slides and content that we've created already to help facilitate their educational product. Our goal is to have everything to them in April so that we can facilitate the creation of the educational product and get that out in a timely fashion. There's also in the background, a subcommittee has been meeting discussing the Jackman pilot project proposal, and we are looking at that in terms of making recommendations to the board in the near future. And that's all I have. I would like to thank Sam and Chris for the rapid turnaround for the education regarding the Johnson & Johnson vaccine product. That was pretty amazing considering the EUA just came out and how quickly they had that out to us. So I need to give them credit.
Thanks, Dr. Zimmerman. I do have a quick question related to that. It may be for Chris and or Sam or to you. EMS agencies that are participating or running other clinics that may have access to the Pfizer vaccine, is that allowable at this point, or is there any issue with that?
In terms of giving the J&J vaccine?
The Pfizer vaccine.
Or the Pfizer vaccine? Sam, do you want to answer that question?
I know he stepped away. He sent a note. So not a big deal. We can catch up offline. There are kind of two scenarios, EMS run clinics and EMS individuals helping with hospital run clinics, but
Right.
we can catch
What
up
was
on
the
that.
question? What was the question, Joe?
It's Pfizer vaccine education for EMS run clinics.
Go ahead, Chris.
We don't currently have any, as it wasn't, and I'm paraphrasing. Actually, I'll let Sam answer that question as he just came back up online.
Sorry about that. I had to step away. So yes, we currently do not have education for Pfizer because the intention was that EMS agencies would not directly receive Pfizer vaccine. However, based on the training that is already available, we did indicate that if you're working in a clinic or you're working in another setting that uses the Pfizer vaccine, as long as you receive training from that clinic or that entity regarding the Pfizer vaccine itself, so administration, because it's 0.3 versus 0.5 with the other doses, handling those types of things, you could administer it. The problem is you can't document Pfizer in MEFRS. So you can't administer it as an EMS agency, but you can administer it like if you were working in a clinic or if you were working at Scarborough Downs. It's totally fine if you administer it as long as you receive training on that vaccine. You're eligible to administer it, but you have to have some training, and the training that we originally put out indicated as such and said you just need to have that documented and have it signed off by whoever the medical supervision is at that site. So yes, because they did that in York County. They're EMS clinicians administering Pfizer, but documenting it in Epic.
Thank you very much. Any other questions for Dr. Zimmerman? All right, hearing none, we'll move on to investigations, and I will turn it over to Griffin and Melissa. I will not actually do that. The first thing we'll do is approval of the investigation meeting minutes. This is approval done just by the investigations committee. At this point, if there's a member of the committee that wishes to make a motion about the minutes that were distributed, I would entertain that motion now.
This is Judy. I'll make a motion to approve the investigation committee minutes.
Motion by Judy. Is there a
Joe, I'll
second?
second.
Second by Joe Conley. Any further discussion on the investigations minutes? Hearing none. Tim?
Yes.
Joe Conley?
Yes.
Laura?
Yes.
Amy?
Yes.
Judy?
Yes.
And I vote yes. It's unanimous of the entire committee. All right, on to the cases. I will turn it over to Melissa Griffin. I'm not sure who wants to go first. I'll just let you two take it.
Thank you, Griffin. Do you mind presenting first 21-162?
Yes. So 21-162 is a case for a licensee who failed to comply with the terms of their consent agreement from case 21-116, which was before the board in September. The committee recommends resolving this case by offering a new consent agreement for probation consistent with the duration of the following terms and a reprimand for violating a lawful order, rule, or consent agreement of the board. Terms of the agreement include completion of a CEH course on patient refusals identified by staff within 90 days and quality assurance of 100% of the licensee's patient care reports for a period of 12 months by a qualified individual not affiliated with any service that the licensee works for and pre-approved by staff. Failure to meet all or any of these conditions would result in a 90-day license suspension and may lead to additional discipline within the board's authority. A suspension may be temporarily waived by staff upon good cause shown by the licensee. All incurred costs are to be bared by the licensee. Happy to answer any questions that folks may have.
Any questions for Griffin on 21-162? Okay, at this point, we'll seek a motion to accept the committee recommendation or otherwise.
Make a motion.
Dennis?
Chair Kellner, second.
Okay, second by Rich. I'm just going to, for the record, say the motion is to approve the recommendation by the investigations committee.
Correct.
Very good. Any further discussion about case 21-162? Hearing none. Nate?
Yes.
Tim?
Yes.
Brad?
Yes.
Joe Conley?
Yes.
Heidi?
Yes.
Laura?
Yes.
Amy,
Yes.
Judy.
Yes.
I vote yes. Rich,
Yes.
Dr. Martell,
Yes.
Julie.
I'm abstaining.
Got it. Dennis,
Yes.
Steve,
Yes.
and Scott.
Yes.
There's 1, 2, 3, 14 in favor, 1 abstention. The motion carries. Next case is 20-147. Melissa.
Thank you, Chair Kellner. On this case, Maine EMS had received a complaint alleging that treatment was delayed to a victim of a house fire by the EMS service who responded in lieu of fire suppression measures, and that the patient outcome may have been a result of the alleged delay. After review, the committee recommends dismissing this complaint, finding that there was no delay in patient assessment or in the care provided, and that the patient's final disposition was not a result of or negatively impacted by the assessment or care provided.
Are there any questions for Melissa on case 20-147? Hearing none, seeking a motion from the board to approve the committee's recommendation or otherwise.
Motion to approve.
Motion by Dennis to approve. Is there a second?
Second. Scott.
Second by Scott. Any further discussion? Hearing none. Nate,
Yes.
Tim,
Yes.
Brad,
Yes.
Joe Conley,
Yes.
Heidi. Heidi,
Sorry, yes.
Amy,
Yes.
Judy,
Yes.
Laura, I skipped you.
Yes.
I vote yes. Rich,
Yes.
Dr. Martell,
Yes.
Julie,
I have to abstain.
abstaining. Dennis,
Yes.
Steve,
Yes.
Scott.
Yes.
14 in favor, 1 abstention. The motion carries. Just a note on both of these cases, they were quite complex with a lot of background and a lot of investigation. And while the presentations here are short, just a big thank you and recognition to Melissa and Griffin for how thoroughly they do investigate these cases, compile the data and present them to the committee. It's really helpful and just some really great work. So thank you. The next item is an update to the matrices that allow staff to disposition certain disciplinary investigations. Melissa, do you want to present the changes to this one? The updates.
Sure, you bet. And I'll try to do it in plain English and not complicate things. So basically what we've done is added any violation of the statute, which is now quoted in rules as well, requiring 10-day notification to Maine EMS on certain things, including address change or contact information. Sorry, I did this last time. I should have this pulled up. Yeah, address change, contact information, and criminal convictions. Some criminal convictions we're not able to consider if they're new within a 10-year period and they don't meet criteria, including they're not related to the profession or they are, thank you, Joe, or don't include dishonesty or false statement. We don't have any right under statute or rule to consider those. So you'll see those have been excluded from this letter of guidance delegation order in number 1 here in the middle. Another requirement addressed here in number 2 is any action taken against a professional license that the EMS licensee also maintains. So these can also not be considered if that professional license has no bearing to this profession, and the actions leading to the discipline on that professional license are, again, not related to this profession and don't include dishonesty or false statement. The third exclusion or limitation here noted is relative to D in the rule or the statute, which is the requirement to update Maine EMS when there's any address change. And this is particular for services. So when a service becomes licensed, they make public notice, and part of that information where the base is located. That's done for several reasons, but here we're noting that a letter of guidance may be issued if there's no harm done to the public in a change of base that we weren't notified of within 10 days. And the situation we're specifically looking at is if someone drives up to a base, right, expecting it to be at an address that was previously published, and it's moved and there was no notice, and that creates a delay in care. So those situations would come before the committee, would come before the board. But excluding that, they would be issued a letter of guidance. And then any second or reoccurring offense would come before the committee or come before the board. But we're looking to add this here to this letter of guidance delegation order with a length of retaining this on file consistent with the rest of the orders for 3 years.
So if I may, it might be helpful. One example of this, and what I think was the case that led to this, was we had an individual appear before us that received a misdemeanor conviction for burning trash, and he failed to notify the board. The licensee failed to notify the board within 10 days of the conviction. We processed that person through the normal investigations process, and the discussion was that this is probably something the office could resolve on their own. The only violation here was failing to make the 10-day notification. So that's just one example. I know. So does anybody have any questions about this or concerns about this being delegated to the office in these narrow circumstances?
Chairman Kelly.
Go ahead, Sam.
I do want to point out that if there are things that skirt the line, those will be referred to the board. So, this doesn't require the Maine EMS office to issue a letter of delegation. It authorizes us to issue it. So if there's something that's questionable or we're like, we don't know, that will come back to you guys. So I just want to point that out, that this isn't a binary, like if it's this, then it's this. These are the options that we have. We can, if it meets these qualifications, we can do this, but if we have questions about it, we can send it over to you.
Thank you. Any further questions or comments? If not, I would take a motion on approving the matrices as presented by Melissa.
Joe, it's Tim.
Tim?
I'd make a motion that we accept the amendments to the delegation order matrix as presented.
Great. Motion to accept the amendments. Is there a second?
I'll second.
I got a second by Steve. Any further discussion? Hearing none. Nate?
Yes.
Tim?
Yes.
Brad?
Yes.
Joe Conley?
Yes.
Heidi?
Yes.
Laura?
Yes.
Amy?
Yes.
Judy?
Yes.
I vote yes. Rich?
Yes.
Dr. Martell?
Yes.
Julie?
Yes.
Dennis?
Yes.
Steve?
Yes.
And Scott?
Yes.
Great. It's unanimous of those that are present. Thank you very much. Moving on to old business, staffing retention update. I believe this will go to Griffin.
Yes, I do believe that this agenda item was in regards to the Labor Committee and updates from that, which we did hear from Steve in the staff updates, but I'm happy to elaborate or provide any further information as necessary.
If there are no questions, or go ahead, Sam. Sorry.
That was the intention with this, but it sounds like we covered it earlier.
Yep, I agree. We can consider this done unless anybody has any questions for Steve or Griffin. Okay, we'll move on to the Block It Now scheduling tool.
So the Block It Now scheduling tool has been acquired and is in full service. I know that many of you on this call actually are utilizing it to schedule appointments throughout the state of Maine. And so it has been fully deployed. We are still waiting to hear more updates from Maine CDC regarding their scheduling tool. And once we hear that, those updates, we will keep you, up to date about when that transition will be made to their tool, because we went into this agreement with this will be an intermediary tool until we make that transition. So as soon as we have that information, we will share it with you. But right now we do not have an updated timeline, but the Block It Now has been acquired and is fully operational and being used on a daily basis. So we offer trainings. Jason, correct me if I'm wrong, but I think it's 2 days a week, 1 or 2 days a week, Tuesdays and Thursdays for agencies that they can tune in and ask for help if they need as well for technical support. And then they also have technical support access through Block It Now. And then Maine EMS, we have rudimentary basic technical support that we can help assist them with as well.
Any questions for Sam on the Block It Now scheduling tool? Okay, thank you. Out-of-state continuing education courses, we had tabled this last time. We do have a request from the office to table this again, pending further research. Where it was tabled last time, we did have to bring it up today. And if anybody wants to take it up, say so now, but otherwise I would seek from the board a motion to table.
Motion.
This is Joe, I'll second.
And I assume, guys, it's a motion to table.
Yes.
Yes.
Thank you very much. Any further discussion? Hearing none. Nate?
Yes.
Tim?
Yes.
Brad?
Yes.
Joe Conley?
Yes.
Heidi?
Yes.
Laura?
Yes.
Amy?
Yes.
Judy?
Yes.
I vote yes. Rich?
Yes.
Brent? No, Brent's not here. I'm sorry. Dr. Martell?
Yes.
Julie?
Yeah.
Dennis?
Yes.
Steve?
Yes.
And Scott?
Yes.
Unanimous of those that are here. Thank you very much. Moving on to new business. First item on the agenda for new business is a QI committee requesting adding an additional member, an EMD rep. Sam, who's going to present this today?
Jason.
Jason.
Yes, so thank you. I hope everybody had a moment to read our note that we shared with you for adding this member to the committee. It's been really good, nice over the last year that we have been able to include data from our partners in the EMD side of EMS in several of our quality assurance newsletters. And with that, we noticed a disparity on the committee of not having a representative from the EMD community there. So we're simply asking the board's permission to add that position to our committee today. And then we're going to advertise for that open seat and a few other open seats on the QA committee that we have as well, and then get that back up. So just looking for a motion today.
Great. So the request is to add an additional position to the QI committee for an EMD representative, which I happen to think, editorializing, that it's a great idea. Are there any questions for Jason or motions?
Motion to
What's your
approve.
Thank you. Motion by Dennis to approve adding an EMD rep to the QI committee. Is there a second?
It's Laura. I'll second.
I was hoping you might, Laura.
I think it's a great idea. Thank you.
Any further discussion on the motion? Hearing none. Nate?
Yes.
Tim?
Yes.
Brad?
Yes.
Joe Conley?
Yes.
Heidi?
Yes.
Laura?
Yes.
Amy?
Yes.
Judy?
Yes.
I vote yes. Rich?
Yes.
Dr. Martell?
Yes.
Julie?
Yeah.
Dennis?
Yes.
Steve?
Yes.
And Scott?
Yes.
Unanimous for those that are here. We will look forward to seeing who the applicants are. If the board is willing, I'd like to take the last item first, where we're on a roll here, unless there are objections. Moving on to authorization to purchase training equipment.
Thank you, Joe. And on that last item, special thanks to Melissa. That was her phenomenal recommendation to add the EMD rep. So special thanks to Melissa. So as I mentioned earlier, Maine EMS was awarded $50,000 through a grant that came through Maine CDC. This is training for training equipment. And so Maine EMS has been in the process of reviewing opportunities to purchase training equipment that we can distribute around the state, potentially co-locating at within the regions, and that could potentially be a part of a future regional contract, or potentially housing at the Maine EMS office for distribution throughout the state. We recently have moved from thinking about buying like more simulation mannequins to thinking about virtual reality simulators. I know that sounds really futuristic, but several years ago, I was at EMS Today in the National Harbor outside of DC, and I actually interacted with one of these and did one of the scenarios, and it's really, really cool. And, you know, it does walk through all of the steps. It makes you ask all the questions. It requires you to do a full assessment. It requires you to do all of the skills and think through the process. Now, does it give you hands-on skill on how to do an IV? Not necessarily, but does it walk you through this process of this is how you treat a cardiac arrest patient, or this is how you treat someone having a pulmonary embolus? And this is how you assess them? Absolutely. And so we have been looking at various products throughout from various distributors, just to kind of get an idea of what that would look like. But the $50,000, we are hoping to couple that with some carryover money that we have left over from EMSC that we must spend by the end of this month. Which is another $10,000. So we're looking at about $60,000 that we would like to invest in purchasing training equipment here with some kind of long-term maintenance plan that they have, probably like a 5-year maintenance plan. So the purchase of the equipment itself, the virtual reality equipment, as well as the carrying cases. So if we held them at the office, we could ship them directly from our office. This provides educational opportunities to rural locations throughout the state of Maine, as well as promotes consistency in education throughout the state of Maine, because the scenarios would all be centrally designed and centrally updated in this system. We think this is an incredible opportunity that we just so happen to snag some grant money that has to be spent in a certain area, has to be spent in training and buying mannequins or dummies or training equipment. That's specifically what CDC put the money in there for. And so we are excited about this opportunity. I think it is, it's going to be really cool. That said, as I mentioned, we do need to spend this money before the end of this month. And so I will not have another opportunity to come before you to request authorization. So I'm asking for authorization to spend up to $60,000 based on the remaining funds that are left over from EMSC, as well as the additional $50,000 of grant funding. I'm not sure that we will meet that threshold. I think we will actually be under it, but I would certainly rather ask than not have enough and then be in a mess because I didn't ask for the full amount. So that is my ask. I certainly will keep you abreast and will update you next month as soon as we have all of those details ironed out. It will have to go out for an RFP, but we've already kind of felt out the potential offerings. And so it will be a brief RFP for like 10 days where they will submit a proposal. So we still are within a perfectly good window to have all of this accomplished. And we have been in touch with the governor's office for the financial order to make all of it happen. So I'm just seeking authorization for the up to $60,000 for this training and equipment purchase.
All right, thanks, Sam. So what I would ask the board is to make a motion to authorize the commissioner or his designee, the director of Maine EMS, to expend these funds if the board so wishes.
I'll make that motion, Joe.
Motion by Joe Conley. Is there a second?
Second, Dennis Russell.
Second by Dennis. All right. Any further discussion?
I think this is a great idea. It's nice to see that. I think it's going to be hard for you to keep them in the office because there's going to be a lot of people requesting them. So I think this is a unique opportunity, and I'm glad that the office is sticking their foot in there and trying to get that done. So I applaud your efforts.
Thank you.
Sam, it's Tim. I may have missed it. How many units will that buy?
So the units themselves are about $800 a pop, and they're designed to last for about 20,000 hours. So that's estimated. It depends on use, but that'll be about 5 or 6 years worth of use. And we know how EMS clinicians are with wear and tear. So I imagine we're probably going to get about 3 years road value out of them. And then the expensive part is many of the services that we've looked at, you pay subscription fees, and those subscription fees are per like student, but because we're buying this as a state, it would be per module. So what we would do is we would buy a subscription per each unit that we buy. And so we've been thinking about the around 40 units that we would purchase. And then we would keep them in batches of potentially 10. So that way, because you don't need everyone in your classroom to be in the Oculus at the same time. You can have groups go through it, but we could keep them in batches of 10. And that way we could find reasonably sized Pelican boxes to put them in so we can ship them around and do all of those good things. So we're trying to get this all wrapped up in one. So we have not only the cases to put them in to keep this secure. And when we buy enterprise Oculuses, they also come with tracking. So anytime that connects to the internet, I know where it is. And it's tracked on a central interface so that we can monitor it just in case one decides to grow legs, which you know how some things have magically grown legs in our careers. So we have kind of thought through that a little bit as well.
Thank you. For Sam.
Chair Rich.
Oh, go ahead, Rich.
This is more a question to you, Chair Kellner. Does the motion, I guess I may have missed it, did it include the amount that we're going to spend, or does that have to be in there? Or
I would include the up to 60,000 in the motion for whomever makes it. Oh, it's already been made. I'm sorry.
Already been made. Yeah, I included. Yeah, it was up to 60,000.
Yep.
Thank you.
Thank you.
Any further questions or discussion? All right, again, the motion is to authorize the commissioner or the director to expend up to $60,000 in grant funding for this equipment. We have a motion and a second. Nate. Nate?
Yes.
Tim?
Yes.
Brad?
Yes.
Joe Conley?
Yes.
Heidi?
Yes.
Laura?
Yes.
Amy?
Yes.
Judy?
Yes.
I vote yes. Rich?
Yes.
Dr. Martell?
Yes.
Julie?
Yes.
Dennis?
Yes.
Steve?
Yes.
Scott?
Yes.
It's unanimous. Very good. Thank you very much. All right. At this point, I am going to relinquish my duties as chair over to Chief Susi for the final new business agenda item. So treat me at this point as a member of the general public. Thank you.
All right, thank you, Chair. So the last piece on here for new business is the Lifelight of Maine ground expansion scope request. And Joe, I'll leave. You said you were going to speak on this.
So yeah, I can present what the ask is. Realistically, when we did the waiver request last time, we should have done this as well, but unfortunately it was omitted. The board basically needs to acknowledge, it's not necessarily an approval, but an acknowledgement that Lifelight of Maine will be using the same protocols and expanded scope that they use in the air on the ground. They currently do this as a matter of practice. When they're doing ground transports, they use their same protocols. However, where they don't have a license for ground service right now, the board has never authorized Lifelight to use these protocols and expanded practice on the ground. So what I would be seeking, if it's the board's pleasure, is acknowledgement and authorization for the Lifelight of Maine ground service to use the same protocols and scope used by the Lifelight of Maine air service. We are not requesting any change to their scope of practice or protocols today.
So to clarify, you just want to change it, or put in addition to the air, the ground piece.
Exactly. Yep.
Okay. Anything else on that? Sam?
Yeah, Maine EMS does not have a particular stance on this, but we do think it's important that we have this specifically defined, that because they will have a new license, they will have an air license and a ground license, that it's important for the board to define that that expansion of scope that's covered under their air license is also covered under their, also covers their ground license. So that was why we prompted Lifelight of Maine to make this request. This would just kind of finalize their process for them.
So no issues from the office on this?
No, sir, this would finalize things for us.
Okay. So in respect, I would seek a motion to authorize Lifelight of Maine to use the same scope of practice in their ground service as they do their air service.
I'll second that.
I would probably need, you can first it, Dr. Martel. I would need a second. I'm just asking for the request for someone.
Oh, I make a motion. Sorry.
I'll second it.
Sorry. Yeah. Make a motion that Lifelight of Maine can basically transfer to include their practices from air care to ground care without any appreciable changes.
Thank you, Doctor.
Welcome.
Who had the second?
Heidi.
Heidi. Yep. Thank you, Heidi. Okay. And we'll call the roll. Nate?
Yes.
Tim?
Yes.
Carolyn?
Not here.
Not here. Brad?
Yes.
Joe?
Yes.
Heidi?
Yes.
Laura?
Yes.
Amy?
Yes.
Judy?
Yes.
Joe has recused. Rich?
Acting chair, I'm going to be a yes, but I just had one question. We didn't go to discussion.
Sorry.
It's real. Did we compare this to rule? There's no issue with rules. There's nothing that's going to get messed up in our rules or that it's in conflict with doing this.
Director Hurley?
I'll defer to Melissa on that, but I believe we have to have this because of the rules, but I'll defer to Melissa on that.
That's correct. Thank you, Director. Yes.
Okay.
I mean, yes, sorry about that, Scott.
No, no problem. So you're all set, Rich? My bad. Brent?
Mark has his hand up too to speak on that.
Acting chair,
Yep.
Mark Meeker's hand is up.
Yep, Mark.
I just had a question just because we've been working in ops team on equipment. Currently, the rules define some equipment specific to air medical transport, i.e. ventilators that aren't listed for ground transport vehicles. And is this potentially a conflict or has that been considered?
Yeah, but right now, Lifelight of Maine has a different scope of practice for their air service. They're looking for the same for their ground.
That's correct. By rule, they would be required to carry all of the equipment necessary to perform the protocols, including their expanded scope. Yeah.
Does that answer your question, Mark?
I think so. I just wanted to make sure that the rules specifically don't allow a ventilator on a ground ambulance. So I didn't know if that presented a conflict because it is specifically allowed for air transport as an equipment item.
But
So
they have a different expanded scope of practice than the regular rules outline.
okay, thank you.
Okay. Dr. Martel?
Yes.
Julie,
Yeah.
Dennis,
Yes.
Steve,
Yes.
and I'm a yes. Okay.
Thank you
Passes.
very much.
Yep. Chair, you're back in.
Thanks, Chief Susi. The rest of the agenda is pretty straightforward. Items for the next agenda from anybody that you'd like to see. As a reminder, if anybody does have agenda items they'd like to discuss in our board meeting, don't hesitate to send those to Brent, Sam, or myself, and we'd be glad to get those onto our agendas going forward. The next time we'll see each other is April 7th, 2021, which will mark a year of doing these remotely, incidentally. I'll look forward to seeing everybody, and at this point, I would take a motion to adjourn.
Joe, this is actually, Joe, can I ask a question?
Go ahead, Amy. Yep.
I had sent out, and I think Sam responded to me about the Binex Now kits and services and the expiration date. Can we just kind of touch on those really quick before you guys leave?
Yeah, it's an additional agenda item, so as long as there's no objection from the board, I would turn it over to Sam to touch on that.
Yeah, we are actually going to be publishing a memo today about the Binex Nows, and they were granted, almost every single lot was granted a 3-month extension onto the expiration date last night from the FDA. Because they're issued under an EUA, it had to be granted by the FDA. So they did grant a 3-month extension. But should we run into this in the future, we will transfer those to other high throughput sites to make sure they are used, and then backfill you with new kits. But literally last night, I think it was 8:30, I got an email saying that, oh, by the way, we just got this extension for 3 months. Very convenient, after I had already transferred like 20 kits yesterday. Naturally, I did want to mention one thing, Joe, before we moved on, and I hope this doesn't drag us into noon by the time I finish this conversation, but we'll see. It is time for us to have to put the contracts out back for the regions, and so Maine EMS is more than willing to draft potential language and then submit it to the board as an option. Or should we have a subcommittee of the board meet to discuss that after we submit some kind of language? I think it's always good to bring a solution to you rather than just bring a problem and say, here, figure it out. So I just wanted guidance from the board as how they want the Maine EMS office to handle this. We are more than happy to come up with these are what we think is, this is the ideal solution that we think would be for going forward, and then let the board ponder on that. But I would like to consider that, because that does need to be likely voted upon, or at least considered next month, so that we can start that RFP process.
What's the feeling of the board?
This is Judy. I think that's very appropriate for them to draft it for us to look at. At least it gives us a starting point.
Does anybody disagree with that approach?
Joe, it's Tim.
Tim?
The only thing I would ask is that if the office is going to draft that we get it with enough time so that for those of us that represent regions, we can have a discussion with the region office so that it's not, we're not getting it the day before.
I think that's a great point.
I do too.
Would it be fair to say that a couple of weeks could be expected, that give you enough time, Tim, to go back and discuss that? And Sam, would that be possible to put a charge out there that you'll get it a couple weeks prior to the next meeting, so they have enough time to really vet any of the questions and those types of things?
So would that be by the 24th of March? That would give you 2 weeks before the 7th meeting?
Yes. Is that feasible for you?
We can do what we can. we can do our best. We can do our best with that.
I think we'll be able to make more headway in our meeting if there is that time frame. I think if we get it much less, than that, to be honest, we may not have as productive as conversation as we could.
Okay, so that'll be the request.
Can I ask one question? I think my concern is I think it's important for you to have these conversations with your regional councils rather than the regional contractors, because they are the contractors, not the council. That would be my suggestion, is that it goes to the council, because they actually serve the council in the region. And we don't want the contractors directing the direction. Now, I love all of our regional, don't get me wrong. I just want to make sure that we aren't violating RFP rules here in the state of Maine, because we're asking our contractors what should be in their contracts. That's my concern about that. But again, that is totally up to you all. But I think I don't know if you need more time is the question I'm asking, for you to ask your regional councils.
To go to the regional council, we would need more time.
Okay.
We cannot, we would need, to coordinate with all the regional council meetings. This isn't something that we can just take up at the drop of a hat. And quite frankly, it should have been on the agenda for today. So we all had time to think about it. So historically, everybody has had to send in the letter of interest. Did we get those?
Yes, sir. All of the current organizations send in letters of interest. Yes, sir.
So we probably won't have to start a new RFP process then.
Well, I mean, we could potentially continue the one we have now, but we would have to do contract modifications on all of them, because I don't necessarily know that the deliverables correctly reflect the needs of our system currently.
And what's the timeline?
So we need to have something in place by June 1st.
June 1st. Okay. So Tim is right. This should be a formal agenda item. What I would recommend, if everybody else is okay with it, is still proceed if the office wants to come up with some recommendations that we can react to. But what I would recommend is we don't plan to vote on those at the next meeting, to have a discussion. And then at the May meeting, we would vote on the path forward, if that sounds okay to folks as a point of process, which should hopefully give time to bring the thoughts back to the regional councils.
Does that take care of everything as far as RFP rules and those types of things? Doesn't put us afoul with any of the timelines?
Yes, we can make that happen. As long as we have especially if we already know the interested parties, because we had the letters of interest process. We can potentially make the RFP process 10 or 15 days.
Are there any objections from the board on that approach? Okay, very good. We will consider that the plan, or to discussing it next time with a vote. I said May 1st, so it's May 5th is the May board meeting. All right, at this point, there being no further business to come before the board, I will take a motion to adjourn.
Motion.
Motion by Dennis, is there a second?
Second.
Second by Scott. Thanks so much, everybody.